Recently, I sat down with Michael Hamilton, one of the founders of CI Security, for a discussion around how digital security is happening within healthcare. Listen to this clip and consider the following two questions. What would the impact be on your health system if you experienced a major health records breach? And also, what is your role specifically in protecting the records of the patients in your system? Have a listen.
World.
Well, so that leads me in two directions. One is, part of me wants to have us put on black hats and say, okay, how are we getting in? Because that's going to be one of the questions they ask us, is like, how are people going to get in? But the other thing is, when you have conversations like that with the board, they immediately go to risk. They go, risk? Oh, I know how to mitigate risk. Let's get insurance. And then when this happens, we lean on that cyber liability policy. And, first of all, you're not going to get a fine for $400 million, because the federal government's job is not to put you out of business unless you're grossly negligent. And for the most part, they need you providing care in the communities that you're serving in. So those fines end up coming down pretty significantly. They could have easily put Anthem out of business.
Yeah, absolutely.
Just do the numbers. And so to a certain extent, we have to educate the board on more than just, hey, there's a risk, there's a financial risk, there's a lot of other risks associated with it. So let's put on our black hats for a second, or let's be white hat hackers, I guess. How are we getting in? I mean, the easiest is through people, right?
Right, absolutely. It's, fooling somebody is a time-honored tradition. And if I can get you to give me your password so that I can just march into your network, maybe implant some kind of malware that's, put it on your computer, because now I have access to it, and start a ransomware event or something like that in order to extort the hospital.
So what are we going to do?
Credential theft is rampant right now.
Are we closer to the point where people don't even know their own password, but they can still get into systems?
Yeah, we're getting there, honestly. In fact, some of the controls that we use in order to administer our customer premise equipment, right? The collection device we put on a customer network to hoover up a bunch of security events and send them to analysts. When our analysts have a need to actually make a connection to those, they don't know the password. And we do this, they use one-time passwords that are not good anymore. Right? So there are ways to do this, and I think we're getting to the point, I don't know if you saw a story today, Amazon is experimenting with completely facial and bio-authentication methods rather than anything else. So you walk into one of their stores, you're already recognized, they have your credit card on file, and that's that. So, I think it's being led by, big corporations in the private sector, to increase retail businesses, but these methods are going to be pervasive sometime very soon.
Yeah, because as long as people know their passwords, they're gonna potentially give them away. So that's one of the areas. Another area is people just go into certain websites, and that's another way that this stuff gets transferred, right?
It is, but I would make a distinction here, because there is a difference between a targeted attack, an actual attack where somebody did some research and they penetrated your organization on purpose with the intent to steal records or to extort you, versus somebody visited a website today that was bad when yesterday it was okay. That is the background noise of the internet. And tripping over the background noise of the internet isn't personal. It's not targeted. It wasn't meant for you. And there is a difference there. But yes, that is actually another way that's fairly prevalent. Is it's called, just a drive-by attack. You hit a website. Now, there are times when there are websites that are known to be frequented by a certain sector or another. I'll just pick one out of the air. The Becker's Hospital site. I know the kind of people that visit that site. And so if I can compromise that site so that the visitors then are compromised with whatever malware I throw at them, I'm pretty sure I've gotten people in hospitals. That's called a watering hole attack. So that's out there too. But I think it's good to distinguish, because the motivation of the threat actor is something that we need to keep in mind here when we're talking about risk. And just let me respond really quickly to the issue of insurance. I live in Seattle. We don't insure against rain. It just happens all the time. It is a foreseeable event. Could a hurricane happen here? Well, yeah, you know what? It's not outside the realm of possibility. It could happen. So when you identify risk, there's 4 ways to handle it. You can completely avoid the risk. You say, we're just not going to do that thing that's risky anymore. You can accept the risk, right? The 1971 Ford Pinto method of risk management. They blow up. We know it. We'll just pay people off. We don't want to fix them. You can mitigate that risk through the application of controls, and this is where we ask for money, or you can transfer it through risk. Transferring your risk using insurance should be done at the end after you've done those other 3 things, and that's residual risk. You're not going to be able to keep out a nation state if they want to steal your cancer research. They're going to be able to do that. That's the hurricane that you should insure for. Soapbox off.